Okay. Hello, everyone. We're talking about cupping therapy for my literature review. Um, so you'll hear sometimes cupping therapy referred to as myofascial cupping. So what usually they use is glass, plastic, ceramic, or bamboo cups to use for cupping therapy. So as you can see, they're placed on the skin, directly on the skin to create localized suction. So that's why you'll see kind of the skin raising up and causing kind of like a bump, which is filled with blood. What's happening here is negative pressure is created by either applying the flame, in which he's doing in the picture, or by using some other suction device, which you'll see in the next picture. So here you see wet cupping, which has to do with small incision sites placed on directly on the skin. And then there's also something called dry cupping therapy, where it's only suction only. So you would see the same type of cup with the suction device, but just without the medicinal bleeding. So when these are removed, usually you'll have ointment or bandages placed to control, any type of, or prevent infections, what I meant to say. A person's health, medical condition, or preference is going to be the determining factor on which one of these you use. So some indications, they can be used for healthy patients and people suffering from ailments, so any type of injury or something like that. It's usually used for health promotion, preventative and therapeutic purposes, and then some of the reported benefits it's most commonly used for musculoskeletal pain. It can also be used for headache, migraine, hypertension, carpal tunnel syndrome, diabetes mellitus. And the most common sites are usually a space where there's a lot of surface area, so the back, the chest, the abdomen, the legs. So in general, CT is contraindicated directly over veins, nerves, arteries, any skin lesions, infection. And then there's relative and absolute contraindications. So relative is defined as to be used with caution when using in conjunction with cupping therapy. And then absolute contraindications could cause life-threatening situations, so you wouldn't use those at all. So side effects, there aren't a lot of side effects, and the ones that could happen are going to happen either during treatment session or shortly thereafter. So some of those include lightheadedness, dizziness, sweating, nausea, and then you will see skin irritation around the rim of the cup most of the time, and then pain at incision sites with wet cupping therapy. Others include infection, scarring, and bruising. Now, infection, as long as you're doing, or the practitioner is using correct infection control, then that should not become a problem. So for the first research article, it focused on CT on amateur and professional athletes. So there were 498 participants, 6 different sport populations, including swimmers and football players, both dry and wet cupping, as well as cupping massage, and then used in conjunction with other treatments, so stretching and instrument-assisted soft tissue mobilization was also used, and it was applied 1 to 20 times over 1 day to 6 weeks. Participants reported decreased pain and disability, increased range of motion, and reduction of creatine kinase compared to mostly untreated control groups. So that usually has to do with soreness in the muscles. So weaknesses of this review mainly focused on not having detailed descriptions of those treatments, so they were not able to be replicated. And then ultimately no recommendation could be used for or against cupping therapy. The second research article focused on relieving or cupping therapy within the effects of relieving chronic neck and shoulder pain. It was a randomized controlled trial, and it was also a level 1 research. So the inclusion criteria for this was, of course, people needed to have neck and shoulder pain for at least 3 consecutive months, and they needed to be working 40 hours a week. And then the visual analog scale needed to be at least a 3-point. Again, we see both young and older people in this case study with a median age of 44 years old. And then the 3 acupuncture points where the cups were placed are listed there. The post-treatment visual analog scale did show a decrease by 5.9 in the cupping group and 0.6 in the control group. So it did show a good effect. It did show improved physical function by vasodilation and stimulation of blood circulation, causing an increase in metabolism and elimination of waste toxins. So again, that creatine kinase. So the efficacy of cupping therapy is supported by the study, in which it indicated significant and effective relief for neck and shoulder pain, and it couldn't, but the long-term effects of cupping therapy could not be determined. In the final article, this focused on patients diagnosed with chronic fatigue syndrome. So this was again a study, but this was mainly people with 18 to 34 years old. 6 different criteria were used, including definite onset of CFS lasting at least 6 months. It excluded people who had already an explanation to why they were fatigued, and people with cardiovascular, cerebrovascular diseases. 295 patients were screened. Only 112 were actually eligible, and then those were randomized and separated into 3 different groups. They received cupping sessions for 10 minutes twice a week over a 5-week period. So those are the 3 different negative pressures that were used. So the acupuncture points were DU14, BL18, and DU4. They were all used simultaneously, and then are placed on the skin simultaneously. Primary outcomes in this study showed significant decrease in fatigue, and then secondary outcomes showed a decrease in anxiety, depression, sleep quality, and then thirstability in this study, or the outcomes were based relatively on short-term measurements, so they weren't able to bring people back longer than 6 months. So the overall quality of evidence, again, I showed in the PowerPoints that each of these were level 1 research. So the first article, the main point there was that additional studies are necessary for a conclusive judgment of the efficacy, safety, and mechanisms of cupping in athletes to provide up-to-date evidence to athletes, sports associations, and healthcare facilities. In the second article, evidence-based practice for cupping therapy to relieve chronic neck and shoulder pain showed effective relief in those areas while serving as an analgesic to improve physical function, and then no side effects were seen or noted. In the third article regarding EDP, we did see a decrease in fatigue, anxiety, and increase in sleep quality. So it was confirmed as a curative effect for CT. And then, so the research and knowledge in these studies would give a therapist confidence to use CT as a modality to treat patients in a clinical setting as well as a sports training facility. And then for my patient scenario, so a patient that cupping therapy would be used on. So I have a patient who is a high school quarterback. He's having muscle pain and soreness He is having trouble with all the motions of throwing a football. He is a quarterback, so he's having trouble with flexion, horizontal deduction, lateral rotation. So all those motions, and some of the interventions that we would use would be, increased shoulder range of motion, decreased pain, strengthening the upper extremity, and we're going to use a dry cupping therapy to relieve pain or inhibit pain as well. And then it's going to be outpatient therapy 2 times a week. All right. So if there's any questions, I will answer those. And then I have my references. So thank you.